Diseases that affect women the most vary depending on various factors such as geographical region, age, and living conditions. However, some diseases are more common in women globally, including heart diseases and strokes are the leading cause of death among women worldwide. Risk factors include high blood pressure, high cholesterol, obesity, smoking, diabetes, and physical inactivity. Breast cancer, it is the most common cancer in women, with high prevalence and mortality rates in many countries. Regular screening, early diagnosis, and appropriate treatment improve the chances of survival for patients. Cervical cancer. This cancer is primarily caused by persistent human papillomavirus (HPV) infection. HPV vaccination and regular screening can help prevent and diagnose this disease at an early stage. Mental illnesses. Depression, anxiety, and eating disorders affect women more than men. The reasons for this gender disparity may be related to hormonal factors, social pressures, and gender roles. Osteoporosis. This disease, characterized by reduced bone density, mainly affects women after menopause due to hormonal changes. A balanced diet, regular physical activity, and calcium and vitamin D supplements can help reduce the risk of fractures. Autoimmune diseases such as systemic lupus erythematosus, multiple sclerosis, rheumatoid arthritis, and Hashimoto's thyroiditis mainly affect women. These diseases are characterized by dysfunction of the immune system attacking the body's own cells and tissues. Respiratory diseases. Women are more likely to suffer from certain respiratory diseases such as asthma and chronic obstructive pulmonary disease. Smoking, exposure to air pollution, and hormonal factors may play a role in the development of these diseases. Thyroid diseases. Thyroid disorders, including hypothyroidism and hyperthyroidism, are more common in women. These conditions can have significant effects on metabolism, energy levels, and reproductive health. Urinary tract infections. Women are more susceptible to developing urinary tract infections due to their anatomy, including a short urethra and proximity of the urethral opening to the anus. These infections can cause uncomfortable symptoms such as burning during urination and frequent urination. Polycystic ovary syndrome. Polycystic ovary syndrome is a common hormonal disorder in women of childbearing age. It can lead to menstrual problems, hormonal imbalances, and difficulties conceiving. Weight management, regular exercise, and a balanced diet can help manage the symptoms of this condition. It's important to note that these diseases may have specific risk factors and symptoms that require medical monitoring and appropriate care. It is always recommended to consult a healthcare professional for an accurate diagnosis and proper treatment.